post-COVID-19 world. Indeed, nurses and midwives have been in the front line in the fight against the deadly COVID-19 pandemic within the Kpando municipality. It was and continues to be a frightening moment for all of us following the confirmation of the first case of COVID-19 in Ghana as well as in the municipality. Dr. Chairman, permit me to congratulate all nurses and midwives for the bravery they have demonstrated in the fight against the deadly COVID-19 pandemic. The contribution of the nursing and midwifery workforce to the fight against the COVID is impressive. As we recognize and celebrate our contributions to the fight against the pandemic so far, we also acknowledge that the task ahead is enormous. The impact of the deadly COVID has exposed the vulnerabilities and weaknesses in the healthcare delivery system, not only in Ghana, but across the globe. The COVID-19 crisis prompted changes in how we think about health and support. When and where it should be delivered, who should be involved, and what women and other resources should be prioritized. Dr. Chairman, a vision for a transformed healthcare is a global call, so as to have an improved healthcare system that is fit for purpose in meeting the health needs of the contemporary times. More than ever before, every nation envisages a new healthcare ecosystem. Indeed, the toll of the COVID-19 pandemic has compelled the world to think, to learn from mistakes and successes, and to envision how to create a better healthcare system that can deliver the highest attainable standards for all individuals, communities. Now is the time for a rethink on where to go from here as far as the healthcare delivery system is concerned. Dr. Chairman, distinguished ladies and gentlemen, the theme chosen for the celebration brings to the fore the critical role of nurses and midwives in transforming the healthcare delivery system in Ghana and, for that matter, in the Kpando municipality. That is becoming a voice to lead the vision for a transformed healthcare delivery system. The voice of nurses and midwives must be heard in the vision seeking to transform the healthcare delivery system. The significance of the nursing and midwifery voice in the vision for a transformed healthcare delivery system in Ghana cannot be overstated. Not only should the nurses and midwives be consulted, but we must begin to position ourselves as the architect of policy reform that will transform the Ghanaian healthcare delivery system. A whole range of issues needs to be addressed if we are to make the changes needed to improve the health of Ghanaians. And the nursing and midwifery is central to every one of these issues. Dr. Chairman, permit me to share my thoughts with this august house on why nurses and midwives should be the voice to lead the vision for a transformed healthcare delivery system during and after COVID-19. It is evidently clear that nurses and midwives are the heartbeats of the healthcare delivery system. This is due to the fact that at least 90% of healthcare provided in hospitals, for example, have and will continue to require inputs from nurses and midwives. Just think about those of us who are already in the service, right from OPD through the wards, to theater, to every unit. No single healthcare activity can go on without the inputs of nurses. We are indeed the largest group of skilled healthcare workforce and are found at every layer of the healthcare delivery system, even at places where other professionals are conspicuously missing. In Ghana, we can say that nurses and midwives constitute 65% of the Ghanaian healthcare workforce. We are indeed the first and the last to be seen at every level of the healthcare delivery system, and in some cases, we are the only professional that a client will get to see. Additionally, Dr. Chairman, nurses and midwives make a significant contribution to the global and national targets related to a range of health priorities, including universal health coverage, mental health, non-communicable diseases, emergency preparedness and response, patient safety, and the delivery of integrated people-centered care. Clearly, nurses and midwives are one of the greatest and sure resources for the realization of a transformed healthcare delivery during and after the pandemic. Indeed, nurses are considered as an integral component of the health system strengthening approach to quality improvement. Currently, the COVID situation has given us an evidence. We look at the mortality rate across countries. One of the key things that is controlling the mortality rate is the level of nurses in the country. Here, the recent finding shows that high levels of registered nurses in the country is associated with reduced mortality associated with COVID-19. What is this telling us? The key issue here is that for us to address the current needs of COVID and the future outbreak of COVID and other infectious diseases for that matter in this magnitude, we need to prepare a highly trained and versatile nurses and midwives. And for this reason, it is important that we invest in nursing and midwifery education. And that is why, as an association, we are calling for the abolishment of the certificate training of nurses henceforth. We wish that the entry point for a nurse in Ghana should be a first degree, because we realize that the quality of a nurse has a long way to improve the quality of the healthcare delivery system. The COVID-19 has raised the visibility of the nurses and midwives like never before, and has shown that nurses and midwives are indispensable and are the backbone of every healthcare delivery system. Therefore, nurses and midwives must grab this opportunity that has been presented to have a stronger voice in influencing future policy and practice. Dr. Chairman, although nurses and midwives form the bulk of the healthcare workforce, they have extremely low representation at key decision-making levels of the healthcare system. For this vision to succeed, nurses and midwives must be actively involved and engaged. I dare to say that the vision for the transformed healthcare during and after COVID cannot be achieved without the active involvement and engagement of nurses and midwives. Action must be taken to address the lack of engagement of nurses and midwives at senior decision-making levels now and into the future, if managers of healthcare systems seek to transform the healthcare delivery to meet the needs of contemporary Ghanaians. As we demand from stakeholders to engage and listen to the voice of nurses and midwives, Dr. Chairman, permit me to encourage my fellow nurses and midwives to strive for their voices to be heard during the health policy formulation at every level of the healthcare continuum. The time has come for us to actively and meaningfully engage in public policy development, including problem definition and solution framing. We cannot afford to continue to be passive anymore. The days where we are only implementers and consumers of policy of others has gone past us. We know we need to rise up to the new challenge and become a voice in influencing policy. I must admit that the new task requires that we develop a new set of skills such as advocacy and lobbying so that we can meaningfully engage in influencing policies that will be in our favor. In conclusion, Dr. Chairman, nurses are the lifeblood of health system everywhere, a precious commodity that needs to be nurtured and protected. The pandemic has shown that how valuable the nurses are to the health of nations. Therefore, it is important to engage the voice of nurses and midwives in formulating the vision for a transformed healthcare in the post-COVID Ghana. No national health agenda can be realized without concerted and sustained effort to maximize the contribution of the nursing and midwifery workforce and their roles within the interdisciplinary health teams. Nurses and midwives are not only important for effective but they are effective core members of the interdisciplinary healthcare workforce. They have been instrumental in helping to drive tangible progress in the fight against COVID-19. In the face of COVID-19 related restrictions and overburdened health system, nurses and midwives have become even more vital for meeting the health needs of the population. Long live GRNMA, long live Ghana. Thank you for your kind attention.